Good evening, everyone. So, how is life going on? How is your learning going on?
Good for it.
Today, we are diving into sample 3. This is from the official OET website. Thank you, OET, for allowing me to use this for teaching purpose. If you are watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share this video link to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling. Sample 3, reading part A, management of burns. 4 principles of skimming. Okay. So what should you skim for? As I said, main heading is important. Here, management of burns. Then subheadings, which means the focus of each text. So here you have classification, treatment, management, and guidelines. Could you just write down these 4 things in your notebook fast? A, classification, B, treatment, C, management, D, guidelines. Now, third one, you have to look for names. What names? Name of a condition, disease, or medication, or device, or body part, anything of this sort. Any names are important. Then fourth one, you have to look for number and percentage. If they have given some numbers, just glance at it and definitely there will be answer. And fifth one, sequential expressions, initial, later, subsequently, finally, all those sequential expressions, first, second, third. Then classification. If there are classifications, first, second, third, those things are very important. Skim for it. Negative meaning. A question may give you a positive statement, whereas text will give you negative statement. And eighth is time or duration. How long? Okay, maybe 3 weeks you will have to take a medication. Maybe after duration you have to come for review. So just see here, and could you just shout out what are important here?
Burn
We are
depth.
one check.
Then
Superficial
superficial,
part,
first and
First and
second degree.
second is important. Then
Then
full
full
thickness.
thickness of burns.
Those are
third
the
degree.
subheadings. Again, in the same text, there are subheadings. So third
Yeah,
degree is
third
important.
degree.
Then
Mixed depth of burns.
these are very important. Look into, maybe you can read this first one. Burn injuries are classified according to how much tissue damage is present. How much tissue damage? First degree, second degree, third degree, mixed depth. So that is known as the topic sentence. This is known as the topic sentence. And that's why I made classification from the topic sentence instead of burn depth. Burn depth also is okay. That's also classification. Or the heading I decided as classification. That is cool. Now let's go to the next text. Now, what are the important here?
Fluid resuscitation. Such as regime for fluid resuscitation adults.
Fluid resuscitation for adults.
Then children. Yeah.
You know, these are very important. I gave it
Yes.
treatment. I understood this from the fluid resuscitation. It is treatment, right? So
Yes, sir.
I gave the heading treatment. Just I want to tell you, you can make your own heading. It's only for your understanding. And then later on, you know, there are so many numbers here, you know. See
Yes,
numbers.
sir.
But then if you something is spoken about pediatrics or children, immediately you have to come here. If some treatment about adults is spoken of, immediately you have to look only here, not the first and last paragraph. So easy to locate and go fast. And going to third, there are so many things.
Management.
Then
Then
just glance
subheading.
the side heading.
One
Cooling,
Pain
control,
control. Immunization.
and
Debridement.
begin
Application of
application of
antibiotics.
antibiotics. So just have a glance over these things. Okay, that's it. Skimming means that is the thing. Here, coming to text D.
Analgesic guidelines.
Now here you see pain score elicited, mild,
Yes, sir.
moderate.
severe.
When you have such tables, just look at the top column
Subheading.
where you have the subheadings. Mild, moderate. These will be given in the questions. So immediately you can locate the answer. Okay, now here recommended analgesia, paracetamol, and if needed, coming here. Okay, see like the other paragraph, you have here pediatrics, you have here adult, and the questions will give you some clue, adult, analgesic, or pediatric. So if it is pediatric, you need not bother anywhere here. You can just come down here. Only look this last portion. That's how we defeat our biggest enemy. Who is your biggest enemy?
Time.
Step 1, skimming for a general idea. That's what we did. And main heading and headings of each text. subheadings. These are the things we have to look into. Then step 2, focus on topic of each text. Okay, classification, treatment, management, guidelines. That's what we have done already. Step 2, skimming. 4 texts we have done. 4 texts we have skimmed, right? Okay, subheadings of a text A, classification, burn depth, first, second degree burns, then third degree burns, mixed depth burns. This is what we did. Skimming the 4 texts. I'm just summarizing it. Text A, classification now. Burn depth, superficial partial thickness burns means first and second degree. Full thickness burns third degree. Mixed depth burns. This is all the skimming focus. So you see these 3 things. Main heading, burn depth. Topic sentence, burn injuries are classified according to how much tissue damage is present. This is very important. Usually from the topic sentence you will have questions. Okay. Then you have the classification so that you know exactly how to skim a text. And these headings, subheadings will guide you to the answers. Text B, all these are important. Okay, see, adults, children, percentage per kg, ml, all those things, size, number, measurements, all these are important. Adults and children, because the question will definitely differentiate between adults and children. So immediately you can go to children or adults. So main topic, management of burns. Subtopic, text B, fluid resuscitation. Main heading, fluid resuscitation. Then you have the topic sentence. Then you have the subdivisions, adults and children. And you have the topic sentence in the beginning. And definitely there are some percentage, percent, and all those things given. Usually there will be an answer. So step 2 is main idea, subheadings of each text. Fluid resuscitation is the subheading, adults and children. Those are the 2 aspects. Third one, management. We have already looked into. And fourth one, adult analysis guidelines. Step 3, skim for stem words in the question statements. Now we have seen the main words and skimmed the text. Now we are going into the question statements. Taking the clue from the question statement, we will be matching the text. Match the text. Sometimes you have 5, sometimes you have 6. Most of the time you have 7 questions to match the text. Say this statement is from text A or B or C or D. Now, could you tell me what is a hedging word here which leads you to one of these texts? Age-related consideration for initial treatment of burn injuries.
Initial treatment.
B.
B, treatment, yeah. Then risk
Management.
Risk management. Automatically, when you know risk is, usually you say risk management. Then when to start thinking about specialist treatment. Specialist treatment. You need some special treatment after your treatment in the hospital. You need to send the patient to somewhere else. Where do you think of it? Which stage?
Guidelines.
Specialist treatment is after the normal. Okay, treatment informed by patient self-assessment. Guidelines. Yeah, guidelines. How to categorize
Classification.
Classification. First one.
Classification.
So sometimes you have 7, which you can do within seconds. 70 marks. So cool. See, initial treatment, that is correct. Risk management, special treatment guidelines, informed by patient guidelines, categorize, classification. Category means classification. Same synonyms. That's why I said synonyms are important. Now coming to question number 6. Classification of burn injuries. Which text it will be?
A, Father.
A.
Classification.
See how easy it is. Patients recovering from third degree. Where it will be?
A classification.
A, again A. And when evaluating mixed depth burns.
Classification.
Again A. See,
Classification.
easily you can go in A. You need not look anywhere. Only in that portion where mixed depth is given. Or the previous third degree is given. So immediately you can go there. 9th one. You should cool burn injuries.
Management.
Management.
Yeah.
By taking off any dash or jewelry. When do you take off jewelry? Is it after the treatment or before the treatment?
Before treatment, sir.
Yeah, before you debride and all those things, you have to remove jewelries and all that, right? When cooling the wound again.
Treatment. Again,
Cooling the wound.
Treatment.
B. The patient may require dash booster depending on when they were last immunized.
Management.
You should consider leaving dash undisturbed as this may help prevent infection.
Treatment, sir. Like
Treatment,
consider
yeah,
leaving
treatment.
blister.
Probably, You should apply ointments containing dash to all deeper burns.
Treatment.
Apply on.
Treatment.
Let's confirm. Yeah. See now, classification A. No, third degree A, already correct. Mixed depth A. Cool burn injuries C. Cooling the wound is called C. Okay, that was management. 11th one, management, and it should consider leaving dash to prevent inspection. Again, management. Now coming to 14. In the case of mixed depth burns, again, A. What is the maximum of tries recommended for attaching a drip at the scene of burns incident?
Treatment.
Treatment. Okay. Yeah. How much resuscitation fluid should a child receive per kilo over
Again, treatment.
Treatment.
20 kg is the number here, okay, in the question. We'll see some numbers in the text. Before attaching a fluid resuscitation drip to a 9-year-old, you have to go immediately to children. Child. Fluid resuscitation drip. B, right? Yeah.
B.
Then what additional analgesic is recommendation? Where it happens? Recommendation.
Guidelines.
Recommended guidelines, yeah. What route should be used to administer ibuprofen to children? Again, you have to go to child, pediatric or child, administer ibuprofen. What route? What route means orally or through IV? So, where it should be in under treatment or management or guidelines? After how long should a patient's pain relief regime be re-evaluated again when a review comes under guidelines. Yeah, guideline. Cool. Let's check. Okay, 14. Mixed depth burns A. Identify the answers in the text. Now you see, they use synonyms. Here it is classified, but one of the questions says categorize. How much? Amount of. And considerable contraction, get rid of shrinkage. Contraction, shrinkage. Synonymous. Appearance, looks. Presence of, there is. What factor? Based on. These are the words used in the question. Let's check. Part A. The classification of burns injuries depends on the amount of tissue damage caused. That is sixth question in the topic sentence. I said first sentence, topic sentence are always important. See, burn injuries are classified according to how much tissue damage is present. Classification of burn injuries depends on the amount of tissue damage caused. You have to write down in the initial stages, you have to write down this sentence as well as the question statement in the notebook. Gradually, you will develop competence in second one. Patients recovering from third degree burns are likely to experience a great deal of shrinkage and scarring of their skin. Third degree. Where is third degree? Immediately, you know. Immediately, as you see third degree, you just come here. Number 2. This one. So, immediately you come here to find the answer. Patients recovering. Healing. Synonym used is recovering. From third degree burns are likely to experience a great deal of shrinkage, considerable contraction, and scarring of their skin. Usually, and or conjunctions they test you. Next one, when evaluating mixed depth burns, immediately you know you have to come here, mixed depth, right? Below. Last portion, 3. You should take into account how the burn looks and whether there is sensation in the affected area. Presence of?
Sensation.
Yeah, second line, you see. When evaluating mixed depth burns, you should take into account how the burn looks and whether there is sensation in the affected area. Presence of? There is. Looks, appearance, synonyms. Next one, 14th one. In the case of mixed depth burns, what factor determines the local treatment to give? What factor? Based on. Synonymous expression. Okay, local treatment should be based on the burn thickness.
Yes.
Is that cool?
Yes, sir.
Yes, Father.
So you see, beauty of the synonyms. These are, I said you have to keep a diary of synonyms and synonymous expressions. Question says classified. Text says categorized. Amount of? How much?
How
Recovering? Healing.
Healing.
Great deal of shrinkage, considerable contraction. Evaluating? Estimating. Looks? Appearance. There is presence of. What factor? Based on. Now, text B, I am not going to analyze the whole thing. Synonyms, see, initial, as soon as possible. Initial is the time expression. Maximum. Text says no more than 2. No more than 2 means 2 is the maximum. Okay, that's what I said, negative expression. And this is synonymous expression as well as negative meaning. Scale is used, maximum, minimum. Then drip, cannulation. Then that is synonym. And per kilo over 20 kg. each extra kg. Means when you have 21 kg, how much should be given? That is synonymous. And 20 kg, 10 kg plus 10 kg.
10 kg.
Question says 20 kg, but text says 10 kg plus 10 kg. Yeah, that is synonymous. Means same, right? And last one is 9-year-old
9-year-old
child.
child.
Means children.
Children.
That's it. Reading part B. See, this is the question. Could you read the question?
Doctors are advised to break patient confidentiality if
What is the key word here? Stem word?
Advice.
Advice. And there is also if. Yeah, doctors are advised to if something happens. Only if something happens.
option A, failure to do so would put other people in danger. Option B, they inform the patient of their intention in advance. Option C, a patient refuses to disclose information relevant to their care.
A patient refuses to disclose information relevant to their. The patient doesn't disclose anything. He doesn't speak at all. Can you break the confidentiality? He doesn't reveal anything. Is there a question of breaking the confidentiality then?
No.
Which means it is not at all relevant. The C one is not at all relevant. They inform the patient of their intention in advance. That's a factual statement. It's a fact. Failure to do so would put, what does would speak about?
Model verb.
Model
Be-
verb.
Model verb about the future, right?
Yes, Father.
You can break the confidentiality if such a situation arises. If means speculation, predicting the future. So here there is a speculative modal verb. If conditional, would speculation. Advisory is, you see here, advice, recommendation, suggestion, should, not must. Okay, so it is an opinion. The second one is a factual statement. Third one is not at all relevant. So modal verb should is used here, which means advice, which is also given here. And you will see in the paragraph, see, should is used, should be informed, should be disclosed promptly. Did you get the idea?
Yes.
See, this is should means advice, recommendation, or suggestion, or modal verb. Doctors are advised to break patient confidentiality. Should is here, should be informed in advance. However, when there is a contrast word, next, see here, disclosure leaves others exposed to a
Others.
risk. See the words used, synonyms, paraphrasing. See here, risk, leaves others exposed to risk. Here, danger, risk. Synonym, right?
Yes,
Am I audible?
Father.
Yeah.
Yes,
And
Yes, yes.
would put other people, synonym used is leaves
Leaves other.
others exposed to. Looking at this contrast word, you know, this is a question based on exception. Confidentiality is central to trust between doctors and patients is the categorical statement, the topic sentence, but at the second part, after the contrast, they are giving exception. In certain situations, you are not bound by confidentiality. Ethics of confidentiality, others' life is in danger, you can. Should be informed in advance that the doctor will be disclosing the information provided this is practical and safe. Only if it is practical and safe, and should be, it's not must be. Like depends on doctor's discretion whether you should inform or not. Is that clear?
Yes, Father.
Cool, keep smiling. Sample 3, question 2, transfer of patients. And the strategies, clues, or tips that we are going to use is modal verb, elimination of absolutes, tense, synonymous language, paraphrasing, and ignore the subject complements. So already we have taught some strategies to you. Among those several strategies, we will be using these 6 in this one particular question. Okay, let's
Yes,
have a look
Father.
into the question now. According to the guidance notes, all staff involved in transferring patients from critical to general care must. So how do you analyze this? What is important here? Hedging words.
All staff.
They are supposed to do something, right? Who is supposed to what? All staff. Do what?
Transferring people.
Now coming to the options. Tell me what is hedging words or the keyword options A, B, C.
All necessary
All
consent.
necessary consent.
Consent.
Okay. So do you have any strategy here?
Absolute.
Absolute.
Absolute means what you have to do?
Eliminate.
Eliminate.
How many absolutes are there?
Two are there.
2 absolutes. So yeah, so automatically the option is eliminated. Let's check. Second one, ensure that the patient's personal care plan is also transferred. What is important here? And ensure also will be important. We'll have to look into it because must is there. Here there is must. Somebody highlighted earlier, must is there. Okay. The third one is
Ongoing cooperation.
Ongoing cooperation when?
Once
Transfer is
complete.
Once the transfer is
Once
complete.
transfer.
Means this is speaking about something
After
after the
After the transfer.
But what is the question according to the guidance notes? All staff involved in transferring patients. Transferring patients is the present progressive. What's happening now? Okay.
Yes.
What you should do now? Present tense. Present.
Present.
Now this one is third one is after transferring. Transfer is over. Now what should be done? So will it be in this paragraph? No, that
No.
cannot be because of the different tense. You can say, let's see. So we will check it up. Heading is very important. Transferring patients, and so the idea is transfer of patients. Now coming to the text, anything that you feel striking?
Topic sentence transferring team.
Transferring team
transferring
and the referring ward team. Now in the question STEM, do you have any synonymous of transfer?
All staff.
All staff is the synonymous of transferring team and the receiving ward team. Should take shared responsibility for the care of the patient being transferred. They should jointly ensure. Should ensure means ensure is
Must.
should ensure. Should make sure means must. So ensure means equivalent of must. Okay.
Written plan.
Written plan. Okay. Equivalent
Personal
of which?
care.
Personal care. Okay. Written plan is synonymous of personal care. Anything else? A formal structured handover. What does it mean?
Personal care
Personal care plan.
Care
Actually, we have seen that first one is two absolutes, so we'll eliminate it. Third one is actually speaking about what has to be done after the transfer. But the question is not about after the transfer, but being transferred. During the transfer, what is to be done? Okay. So you feel there is answer here? There is continuity of care through a formal structured handover from critical care area staff to ward staff. Here you can eliminate this, ignore the subject complements so you can save time. Ward staff supported by a written plan. A formal structured handover, a written plan is equivalent of personal care plan. So now coming to this second paragraph, when patients are transferred, what does it mean?
After transferring.
After transfer.
After transfer.
They are not asking about after transfer. They are asking during the process of transfer. So should we read this portion?
No need.
That's not required. So you save time. Even otherwise, you are sure
No
the
need for
answer is here. Sample 3, part B, question 3, topic sentence based question. Focus on the topic sentence to understand the gist or main idea in the paragraph. Normally, you will see the topic sentence in the very first sentence. Topic sentence means it speaks about the topic of that paragraph. So let's look into this one, read and follow. Okay. What are the hedging words? The whole thing is known as question stem, and other A, B, C are the answer options. So first step, we have to identify the hedging words, HEDGING, hedging words, or the keywords, say it means same, in the question stem. Could you just tell me what is the main words or phrases in the question stem?
Opinion.
Result in. So they are asking for a result, right? So coming to the option here.
Change.
Prolonged stay.
Yes, another of an issue. Okay, then when you go to the topic sentence, you will find out whether it is similar to any of these options. The concept is screen. Okay, screen a patient. A memo is addressed to hospital staff. Subject is nutrition screening. Okay, nutrition screening. And this is the main idea. Nutrition screening is the subject, and that will be repeated. I'll show you later. Now you see, this is to remind staff of the importance of nutrition screening, the topic, to identify problems which may go unrecognized. Do you have any similarity in any of the answer options, hedging words?
Unaware of
the
issues.
Unaware means unrecognized. Problems, issue. Topic sentence based questions. As soon as you read the first sentence, you will see the synonyms of the same thing being explained there. So easy. Now, do you need to read rest of the thing? You need not read rest of the paragraph at all. Care providers being unaware of an issue. Now, care providers. What is the word used?
Staff.
Staff. Yeah. This is topic sentence. You have staff. In C option, you have care providers. And definitely from a general sense, screening is done for what?
Valuation.
So to identify the problems, you screen the patients. So screening can never change overall health. And screening will not make a person to stay longer in the hospital. Screening will identify the problems and makes the stay shorter because immediately they can be treated and discharged, right? So even from a general sense of medical professionals, you can understand which option is right. If you don't screen, you don't understand what are the issues affecting the patient. Why do you screen? Why do you do the diagnosis? Why do you do scanning? All screening are aimed at identifying the problems, the issues. Even from your general knowledge, you can understand which option is right. Is that clear?
Yes, Father.
Yes.
Yes, Father.
So the correct answer is C, care providers being unaware of an issue. That's why I said only one sentence, even half of the first sentence we have read you, the answer is there. These are from official sample. See now, one more thing. Here, option A is concerned about the patients, speaks about the overall health of the patients. B speaks about prolonged stay of patients, but only third one speaks about staff, care providers. Care providers means what is
Staff.
care? Another strategy I am giving you. See, among three options, that is known as the concept or the idea. Option A speaks about patients, their overall health. B speaks about the prolonged stay of the patients in the care facility. Only C speaks about the staff or the care providers. And the memo is addressed to the staff, not to the patients. From that also you can understand third one is the answer. When it is a memo, try to understand whom it is addressed to. So they will be speaking to that particular group. If the memo is addressed to the staff, they will speak to the staff. If it is addressed to the doctors, they will speak to the doctors. So the option that is concerned about the doctors will be the real option. Now you see here, heading, nutrition screening, and topic sentence, action, nutrition screening, result, identify problems and treat. So the question asked about result. Nutrition screening, when is it done? Then the details are on admission, nutrition screen weekly, nutrition screen at least monthly. If the patient's clinical condition changes, please do the nutrition screening. A weight and height nutrition screening. Weight again means nutrition screening. Malnutrition again speaks about nutrition screening. Dietitian speaks about nutrition screening. Nutrition assessment speaks about nutrition screening. Nutrition support again speaks about nutrition screening. So the main heading, how it is repeated, details are given later. When it is to be done, how it is done, all those things. But first says what is the action and what is the result. Okay. So when it is to be done, nutrition screening on admission weekly, at least monthly, with the patient's clinical condition changes. First they say what happens if nutrition screening is done, then says when it is to be done. Risk at the end they are speaking about for referral if there is a risk. So those things are not at all required here because it is a topic sentence based question. Now care providers means staff, unaware, unrecognized, issue, problems, and even you have may, the modal verb in the question stem, and you have may in this sentence. Okay. So see the question topic sentence, remind staff of the importance of nutrition screening to identify problems which may go unrecognized. And the question says, failure to screen a patient for malnutrition may result in care providers being unaware of an issue. Yeah, somebody asked me in the YouTube, what is exception-based question, right? Let's listen to this question.
4. This policy document states that nurses A must sign a paper form if they want any new stock. B can order medicines from the pharmacy in some cases. C should speak to the pharmacist if a drug is needed urgently.
Now, this policy document, states nurses. Who? Nurses. Must, can, should. Tell me what are the hedging words? Order medicines. Then
The pharmacist.
order medicines. Speak to the pharmacist. Sign a paper form. If stock levels of a medicine are low, the nurse should firstly liaise directly with their ward-based team to arrange urgent stock replacement. And if the ward-based team is unavailable, the nurse should complete a request from online and email it to the pharmacy stores. The first sentence says what is to be done. If stock levels of a medicine are low, what is the nurse supposed to do? The nurse should firstly liaise directly with their ward-based team to arrange urgent stock replenishment. First Normal course of action is to approach the ward-based team. If the ward-based team is unavailable, there is an exception. Normally, you are supposed to approach the ward-based team for medicine, not the pharmacy. But
Yes, sir.
if the team is not available and you urgently need some medicine, the nurse should complete a request form online and email it to the pharmacy stores, which means order medicine from the pharmacy in some cases, in some
Yes, sir.
exceptional cases. This the general order is that you cannot directly order to the pharmacy. The ward-based team will order. You have to inform the ward-based team. That's the general formula or the general rule. But there is an exception. If at all the ward-based team is not available, then you can approach or order from the pharmacy. So what will be the answer? Yeah, B. Yeah, definitely. See, must sign a paper form if they want any new stock. They are not saying signing any paper form. They are saying you have to complete a request form online. It's not a paper form. Online, there is no paper, right? No paper form. Then third one should speak to the pharmacist if a drug is needed urgently. If they cannot speak, they have to order online. There's not speaking about speak to the pharmacist. There is no speaking to the pharmacist. The nurse has to mail them, email online a form and email it to the pharmacy stores. So third one is also not right. When there is no medication, medication gets exhausted, you have to inform the ward-based team. That is the general rule. But there is an exception. If at all you find that ward-based team is not available and immediately you require medicine, then you can fill a form, request form online and email it to the pharmacist and get the medicine. Clear, right? So simple. Yeah. Sample 3, question 5, contrast word based question. Do you have the stamina to go on?
Yes.
Yes, Father.
Yes.
Yes, Father.
Let's see then. Now, contrast word based question, the question and the answer options. So, what are the hedging words?
Guideline.
Guidelines.
Guidelines.
Guideline states what? Can be seconded. Okay.
Consult.
Only a consultant can refer.
Fully responsible.
From your general sense, what could be the answer?
C.
Usually, ICU is responsible, right? Yeah.
C.
Can ICU staff second to other wards? I am not in a good mood. Take all my patients. Can you say that?
No.
No, that's what I'm saying. Most of these questions, if you understand, because from your general knowledge, I tell you, definitely half of the questions you can answer from your general knowledge, but you don't analyze those options. And only a consultant can refer a patient to the ICU. There are so many ways of referencing, right? Not only consultant. And again, only means what? Other strategy, which I am not dealing here.
Absolute.
Absolute. When there is an absolute, immediately, absolute word is that immediately that option is okay.
Wrong.
So simply the answer is that still, since we said it is a contrast word based question, let's see where is the contrast word. Could you see any contrast word? Glance through fast through the text and tell me.
However.
Okay, however, there should have been a comma after however. So this is a contrast word. Okay, and do you have the answer? When patients are admitted into the ICU, they are under the care of the ICU team. Option C says the ICU is fully responsible for a patient in their care. Again, there is a contrast word if you want to confirm it again. It is up to the ICU team to make final decision. Fully responsible. Both sentences mean that. There are two contrast words, both mean same. So what happens? You can just scan through, immediately glance through and find out the contrast word. If there is a contrast word, always the answer will be after the contrast word. That's why we call this as contrast word based questions. Do you have some more stamina to go on? Last question.
Yes, Father.
Yes,
Yeah.
Father.
Again, somebody was asking in the YouTube comment space, what is inference-based question? So we are going into inference-based question, the sixth one. Let's go to that sweet question stem and answer option. Okay. When dealing with patients following a safety incident, staff must avoid. Staff must avoid what? Don't say anything. Then speculating. Speculating means speaking about the future things. Contradicting what others said. Let's see. See here, must is there. Do you have any synonym of must here in this sentence?
Essential.
Essential is the synonym of must. Essential means must. It is also essential that any information given is based on solely on the facts known at the time. You should speak based on the facts. Don't speculate. Don't simply predict. Staff must avoid speculating on the possible causes of incident. Did you get it? See, it is also essential that any information given is based solely on the facts known at that time. Only based on the facts, no speculation. Speculation means maybe this will be like that, maybe that will be like this, all speaking about the future. Predicting. Speculation means predicting. Hope it is clear.
Yes,
Yeah.
Father.
Yes, Father.
Sample 3, text 1, allergic to eating. A clue is contrast word, question 7. And this is how you will deal with today's text. So step 1 is analysis of the question. Identify the hedging words or keywords. Hedging words means keywords, okay? Don't confuse if I habitually say hedging words, that means keywords. Tell me, what are the keywords? This is the 7th question. The case of Lucy Smith highlights the fact that food allergies.
Name Lucy Smith.
Okay, Lucy.
Fact.
Okay. First option may be difficult to diagnose in certain people. What is the concept in this option?
Diagnose.
Diagnose, yes. Concept-based hedging words, we call it. Concept-based keywords. And B are relatively rare in the adult population.
Rare.
C option can cause debilitating symptoms. Next one, often
Treatment.
require urgent treatment. Yeah, treatment. Yes. Option A says diagnosis. C says symptoms. D says treatment. And relatively rare in the adult population. Can you give me one word from your medical knowledge? I want one word. Like
Uncommon.
diagnosis, symptoms.
Incidents.
Prevalence, yeah, incidence. Incidence is also a word. Or prevalence of the food allergy issues, cases, prevalence. So they are the 4 concepts. And you can also understand from the, what is this? Maybe, okay?
Model verb.
And maybe difficult to diagnose in certain people, but they are asking about a fact, right?
Yes.
Fact and opinion. So when they ask fact, can opinion be the answer?
No, Father.
No, Father.
Yeah. Then ultimately what you can do? Even before you go to the text, you can eliminate. Cool. Now, can cause, can, there is one.
Model verb.
Okay. Yeah, model verb. And require, what is the model verb for require?
Must.
Must, yeah, must. Yeah, synonym of must. So you have words here. So can it be the fact be must, a direction or a mandatory instruction? When somebody is speaking about a fact, I am saying all the OET aspirants at EduSkills are really sweet and wonderful and smiling and loving and hardworking learners. Is there a must? Is there a mandatory or
No, Father.
thing? Yeah. Just stating a fact is different from mandatory statement. You must do it, or you must be hardworking, or you must be smiling. That is mandatory statement. If you take that way, differentiate the things options that way, we have only 2 options left out. Are relatively rare in the adult population, can cause debilitating symptoms. Second step, identify the keywords repeated in the text. And just match the keywords with the keywords in the answer options. So let's check. Let's look into this one, read and follow. Okay. Okay, now we have this one. One is diagnosis, one is prevalence, means what is the prevalence? Are they all suffering? How many of them are suffering? How many percent you will find? Is it very rare in adult population all over the world? And the symptoms, does it speak about symptoms or treatment? Does it speak anything about diagnosis?
No, Father.
No, Father.
So in the first sentence itself, Lucy Smith was strolling through Canberra last July. Strolling means walking. Walking through Canberra is the city in Australia. Canberra last July. So what happened to her? She was walking Within moments, she couldn't stand, gripped by pain so severe, she feared she would pass out, the first sign of paralyzing diarrhea. So, among these four, do you find diagnosis or prevalence or treatment or symptoms?
Symptoms.
Symptoms.
Yeah, she couldn't stand is a symptom, right?
Yes, sir.
See how easy in the topic sentence itself you have gripped by severe pain, pain so severe is also a symptom. Okay. Now, what about this one? Are relatively rare in the adult population. Food allergies affect 1% of adult population in Australia. Is it same? The option B says food allergies are relatively rare in the adult population. Text says food allergies affect 1% of the adult population of Australia. 1%. Is 1% mean rare, right?
Real.
Yes,
Very
Not
rare.
many.
Yeah.
Not many. 1%. This is one criteria they create to confuse you in most of the texts. Now, the B option says food allergies are relatively rare in the adult population in India, in Africa, in America, in England, in Germany, in Nigeria, in Pakistan, in New Zealand. It's a general statement. Doesn't say where it is. Are relatively rare in the adult population means the whole world, right? It doesn't specify. But the text is saying adult population of Australia.
Yes.
This is a technique they commonly use. Did you understand?
Yes,
Yes,
Father.
understood.
Yes,
Yeah.
Father.
Here, this is general statement. Option B says food allergies are relatively rare in the adult population, which means understood in the world. It doesn't speak of any state, any country. But this text is speaking only about Australia. Canberra is in Australia, and it is mentioned adult population of Australia. For example, if you say Kerala has very rare incidence of dengue, and the answer option says dengue is very rare in the population. Are they same?
No, Father.
No.
No.
You got the idea, no?
Yes,
You have
Father.
to be very specific because it looks same. At times they give exactly same. The food allergies rarely found in the adult population of Australia. Then you will say C, B option is right. But this is general statement where his text is speaking about particular country. Okay. And the text, as we said, that doesn't speak anything about diagnosis, right? And maybe also is that we said even the modal verb is speaking about an opinion, whereas we are asked about fact.
Fact.
Often require urgent treatment. Is there anything about treatment in the paragraph?
No, Father.
Nowhere treatment
Father.
is mentioned. Nowhere treatment is mentioned. Then you know, even otherwise, you know, she couldn't stand, pain so severe, the physical and mental impact can, and this also, again, physical and mental impact can nonetheless turn a person's life upside down. Okay? So all these are speaking about the symptoms of food allergies. Is that clear?
Yes, Father.
The answer is C option, can cause debilitating symptoms. And step 3, identify the contrast word in the text. Focus on what is given after the contrast word. One more clue. Actually, that's not required here because in the topic sentence itself, they are giving the symptoms and other options are eliminated. Still, I am giving you one more clue. Focus on what is given after the contrast word, match with the answer options. What is given after the contrast word? What is the contrast word? The physical and mental impact can nonetheless turn a person's life upside down. Turn a person's life upside down means what? Debilitating means what?
Worsen.
Disable.
Worsen.
Debilitating means disabling,
Like
making
regret.
somebody flat. Can cause debilitating symptoms. Means debilitating means disable someone. He is not able to do anything. He is flat. Do you understand?
Yes, Father. Yes, Father.
So even without this clue, you have found the answer. Still, I'm telling you, if you don't find that, this clue can be used. The clue is this: you usually have the answer after the contrast word. So the debilitating synonymous expression given is turn a person's life upside down. Means if you put you upside down, head on floor, legs up, will you be able to do your nursing duty?
No, Father.
No.
No.
So debilitating, disabling. Okay, disabling symptoms. So what is this? Question stem asks about a factual statement, but option A is opinion statement. The concept is diagnosis and prevalence. This is what I said. The word rarely you have food allergies in the hostel. Means prevalence is very less. Prevalence and can be debilitating symptoms. Symptoms, the concept, then treatment, diagnosis, prevalence, symptoms, treatment. As you go through the text, you should be able to identify out of these four which does the sentence speak about. And one more tip I am giving you, since the first two sentences speak about pain so severe, paralyzing, couldn't stand, those are all our symptoms. If the topic sentence, first one or two sentences speak about symptoms, the whole paragraph will speak only about symptoms. The answer must be symptoms. That's another clue for you. Okay, now you see, we have seen that there is an opinion statement. We are asked about a fact. So in that way, looking at the modal verb, it can be eliminated. Looking at the concept, that is diagnosis, prevalence, symptoms, treatment, concept-based hedging word, that can be eliminated. Now again, general and particular. See how many strategies you can use. And option B are relatively rare in the adult population versus of Australia, adult population of Australia. So general and particular. Here, general means the adult population in general and adult population of Australia. And third one is symptoms. Fourth one, often require urgent treatment. Somewhere it is given easy about treatment it speaks can nonetheless turn a person's life upside down and may even be life-threatening. Life-threatening means you need treatment. You can understand? You need treatment, but it says may even be life-threatening. May need treatment, whereas option C says often must urgent treatment. Often require urgent treatment means must require urgent treatment. Okay, you should treat them. You must treat them urgently. So may, again, must. Opinion as well as mandatory statement. May versus require means must. And you have to fill in the circle in the answer sheet. Make sure that you fill it correctly. Okay. Top tip, answer is hidden in the question. Do you have energy to go on?
Yes, Father.
So in the question number 8, in the second paragraph, what point is made about food intolerances? What are the important things here?
Second paragraph.
Yeah, second paragraph, beginners, that says you should highlight the paragraphs. You have to number the paragraphs as soon as you get the material. Number the paragraphs 1, 2, 3, 4, 5, 6. Then what else?
Point.
Yeah,
Food
point.
tolerance.
Food
Yeah.
Question.
Point about
About.
food tolerance. We call them as about questions, sweet questions about food intolerances. Option A, scientists continue to disagree about their root causes. What is the main thing here? Concept is causes, right? Root causes.
Causes.
Second one, the symptoms are indistinguishable from those of allergies.
Indistinguishable.
Symptoms. Yeah. So there are two types of what you call hedging words, keywords. One is concept based. That's we are looking at. We'll come back to the other differentiating ones. They can have an unpredictable impact on the person affected. Impact. These are known as concept-based hedging words or concept-based keywords. Option C, option D, the distinction between them and allergies is not widely appreciated. Concept.
Distinction.
Distinction is the concept, right? Concepts. Here you see causes, symptoms, impact. Yeah, please read the text. Let's look into this one. Read and follow. Okay. Okay, thank you. Now, yeah, if you want the differentiating adjective words are disagree,
Disagree.
then indistinguishable,
Indistinguishable. Unpredictable.
unpredictable,
Not
Widely
widely.
appreciated.
not widely appreciated. Okay. So there are the distinguishing keywords, whereas the other one, causes, symptoms, impact, distinction are concept-based hedging word or keywords. Did you find anything about causes and a
No.
agreement and disagreement, a fight between some people?
No, Father.
No, that is clear. So you can eliminate it. Then the symptoms are indistinguishable from those of allergies. Where do they speak about symptoms?
Last, last,
Sneezing.
Yeah,
Itchy
constant
eyes.
sneezing,
Itchy eyes.
itchy eyes, throats,
eyes.
and diarrhea can all be
Can
signs
all
of
be
what?
signs of food allergies.
Signs of food allergies.
Food allergies.
Intolerance can bring on similar warning signs
Similar warning.
as well as things such as headaches, bloating, and general lethargy. As well as means plus and.
Plus.
Okay, the B option says the symptoms are indistinguishable, means same, not distinguishable at all. But here the text says, see, as regards general, this one, as regards intolerance, you have all the symptoms of food allergies plus
Food
as well
allergies
as
plus
headaches, bloating, and general lethargy. Is there
general
a
lethargy.
difference between symptoms of allergies and symptoms of intolerance? Just write down what are the symptoms of allergies. Just write down one after another fast. One side column you write symptoms of allergies. Number 1, sneezing. Number 2, itchy eyes or itchy throats. Number 4, and itchy inner ears. Number 5, asthma. Number 6, rashes. Number 7, diarrhea. These are the symptoms of
Food allergy.
food
Food
allergies.
allergies.
Signs of food allergies. Signs is the synonymous expression of symptoms. Now, next column, intolerance. You have to write all these 7. Sneezing, itchy eyes, throat, inner ears, okay? Asthma, rashes, diarrhea, plus as well as headaches, bloating, and general lethargy. 8, 9, 10. For intolerance, food intolerance, they have given 10 symptoms. Whereas for allergy, they have given
7.
7. So are they same or they can be distinguished?
We can distinguish.
Distinguishable.
Yeah, but then the second option says it is not distinguishable, indistinguishable.
Indistinguishable.
So that is wrong, opposite, right?
Yeah.
Yes.
Opposite
Yes,
of what
Father.
is given in the
Yes.
text.
Yes, yes.
So we can eliminate.
Eliminate.
Then, so third one, they can have an unpredictable impact on the person affected.
Not
Not mentioned, Father.
mentioned.
Not mentioned because
Close
they don't
to it.
say anything unpredictable. They are saying all these signs are predictable.
Yeah.
Right?
Yes, Father.
So the distinction between them and allergies, between them means food intolerances. Them means
Food
food
intolerance.
intolerances. And allergies is not widely appreciated. See now, an allergy, you know, what is between commas are supplements. Subject supplement explaining this one can be eliminated when you read to understand easily. So an allergy is the immune system overreacting to a substance that would ordinarily be considered as benign. That describes the allergy. Definition of
Allergy.
allergy. Then a contrast word. However, something opposite is coming. Okay. However, the term allergy is used more loosely by the general public. Means there is a distinction what the experts, immunologists use and public use. People say they are allergic to a substance because it brings about some kind of adverse reaction in their bodies, some of which can be severe and may resemble true allergic reactions. But unless the immune system itself is directly involved, experts categorize it as intolerance. But again, after contrast words, everything is important always. So, though people say that unless means to categorize something as allergy, the immune system must be directly involved. Means it should affect the immune system. But here they call it as intolerance. There is not allergy, but experts categorize it as intolerance.
Intolerance.
This is called gist-based question. Means now since you have eliminated all the other three, ultimately there is no option, only option, one option is left. The distinction between food intolerance and allergies is not widely appreciated. Means people don't understand, widely appreciate. Okay, there is distinction. There is distinction. Even symptoms are different. Allergy has 7 symptoms, whereas intolerance has 10 symptoms. So, but then people don't understand. So, however, the term allergy is used more loosely by the general public. People say they are allergic to a substance because it brings about some kind of adverse reaction in their bodies. Whatever. If there is some adverse reaction, immediately people say is allergy. You eat some meat, you start itching, then immediately you say allergy. No, it's not allergy, it's intolerance. Okay. So the gist of the paragraph is that with all two contrast words giving contrasting ideas, it says the distinction between food intolerances and allergies is not really appreciated. Is that clear?
Yes, Father.
So this is how, see, first one is not given, second one is opposite, third one is unpredictable, they said, but here everything they say predictable, all symptoms. So again, opposite. Fourth one, distinction between them and allergies is not widely appreciated. These are called gist-based questions. Very sweet, nice. So answer is option D. Okay, shall we go to 9?
Yes, Father.
The phrase via a different biological mechanism in the third paragraph explains, and you know this is what type of question?
Lexical question.
Lexical question. And where will be the answer?
Before or after the highlighted
highlighted
words.
Yeah, first you have to look before the
Before.
highlighted word. If you don't find it, soon after the highlighted
Just
word.
after the-
So let's go directly before the highlighted word. This is the was given before the highlighted word. Okay, this testing method is, however, somewhat unreliable in detecting intolerances. We can read this way without. Yeah, contrast is there. That's one thing. Contrast will say after what comes after contrast is very important. Somewhat unreliable in detecting intolerances. Is there is something similar to that? Because while not fully understood, they operate. While not fully understood again. Is what they say. Without understanding anything, can you connect it with any of the options? Let's see the options. Question 9. The phrase via a different biological mechanism in the third paragraph explains what? The way the skin prick test works in diagnosing food intolerances. This is diagnosis, right? Concept?
Diagnosing.
Okay. Second, how the presence of food impurities impacts on the skin. Impact. See how beautifully they give all the questions. And why the skin prick test may not accurately diagnose again. Diagnose food tolerance. And how food allergies are triggered by substances used in the skin prick test. Triggering. Triggering substances also you can say. Which could be the one? Any idea?
C.
C, Father.
How?
May not accurately.
May not accurately. Means what in the text here?
Not fully understood.
Somewhat
Unreliable.
Unreliable.
See how beautifully it is given. Unreliable, may not accurately diagnose. Diagnose, here synonym is detect.
Detecting.
Food tolerance, again, intolerances is given. This part is the paraphrasing of option C.
Yes, Father.
Yes, Father.
See, so C is right. So for lexical questions, you don't require much time. You can immediately identify if you go just before. Most often, just before the highlighted word. If you don't find, just go soon after the highlighted word. So you did not read the whole text and spend time. Within fraction of seconds, you can find it. Hope that is clear. So I'm
Yes,
not
Father.
going to do the analysis of the paragraph, okay?
Yes, Father.
Yes.
Okay.
Do you have some more strength?
Yes.
Yes, sir.
Yes.
Yes, Father.
Just click the like button. Those who are attending, like button if you have not liked. So if you have not subscribed, please subscribe and please share. So 10th one. Dr. Sutra uses the image of a fireworks factory to illustrate. See, always you find this illustration, illustrate. These words you should learn and understand and find out all the meanings and write down, because very often they use that word. And what else is important here?
Name.
The name.
Okay, name.
The
Okay,
name,
name.
Dr.
Sutra.
Dr. Sutra, yes.
Name.
And image of a fireworks factory. Okay. To illustrate what? So option A, the factors triggering an allergic reaction still remain unclear. Triggering factors, right?
Triggering.
Yes. Then option B, allergic attacks can occur suddenly anytime in a person's life. Occur suddenly, right?
Occur suddenly.
Allergic attacks is common. That's a common concept.
Okay.
It's difficult to foresee which family member an allergy will affect.
Force.
Difficult to foresee. Yeah, difficult to foresee. Then D, option D, the identification of a food allergy is basically a matter of chance.
Identification of
Identification.
Now, coming to the third, you read along from the screen. Let's look into this one. Read and follow, okay? Okay, now allergic attacks can occur suddenly any time in a person's life. They don't speak anything in a person's life, right? Do they speak?
No.
One
No,
person.
Father.
See here,
Father.
today's civilization around 6 to 8%
Most
of
of the children
babies.
will grow.
Babies is plural.
Babies.
Okay, children is plural. Okay, we'll go them some. Actually, some children means again plural. They are speaking about general, means a group. But the second option speaks about a single person's life. In a person's life. Occurs suddenly. They don't speak even occurs suddenly, right? Nothing is mentioned how it occurs suddenly or slowly. Nothing of that sort. And C option, it's difficult to foresee which family member an allergy will affect.
Not mentioned.
No, Father. It's not mentioned.
Not mentioned.
It's not mentioned. Again, which family member means one, right? The text speaks about a group.
Group.
Now, I'm giving you some clues to confirm.
Yes.
Not only to confirm this, why I'm teaching in detail, because when you read all these approaches you should use to develop competency, after that you don't require anything of this. You will immediately understand. Option D, the identification of a food allergy is basically a matter of chance. Do you have anything of that sort here?
No.
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 Nothing is given. The mechanisms that provoke an allergy remain a gray area.
Yeah.
Gray area means?
This is
Not clear.
the synonym of, again, first option. Gray area means it's not clear.
Okay.
Gray area means not clear. This is again the synonym of
Synonymous.
option
Unclear.
A. The mechanisms means the triggering factors that provoke. The mechanisms that provoke is the synonym of the factors triggering. Triggering factors. Synonymous expression.
Okay.
An allergy remain a gray area. Remain a gray area means
Remain unclear.
So first option is the correct option. Hope that is clear. So
Yes,
question number
Father.
11 in the fifth paragraph. Fifth paragraph is important. Immediately, if you have marked it paragraphs, immediately you soup into fifth paragraph. Don't go to count 1, 2, 3, 4, 5 again at every instance. In the fifth paragraph, what point is made about the two hypotheses mentioned? Point. Okay. About
Two hypotheses.
yeah,
About.
point about two hypotheses. First, you have to find out what are the two hypotheses mentioned. How will you find out? Definitely, there will be some transition words used. Correct?
Yes.
Yeah. So they both appear to be credible,
Contradict. Directly contradict.
contradict,
Fail
if
to
Fail
contradict,
to
fail
define.
to define. Yes.
Study.
They should both
Should
be studied, should be studied in
should
depth.
be
Means you
studied.
need more study. Need to study more. So
More.
what does the paragraph say about two hypotheses? Okay. Now, Sutta says the ideal recipe for a food allergy is to be born of allergic reactions and then to have a high exposure to be born of and exposure to an allergenic foodstuff.
Foodstuff.
One hypothesis. Okay. Sutta says, how does the allergy happen? First one should be born of allergic parents plus
Exposure.
have high exposure to an
Foodstuff.
allergenic foodstuff.
Foodstuff.
But there are so many exceptions to this rule that other forces are clearly at work. And who is to say that high exposure is anyway? In contrast, first hypothesis is over. Then next
In
hypothesis
contrast.
is introduced saying in contrast. Once you gain the competency, immediately you know there is a contradiction. So they are contradicting each other. Do you have a contradicting word in any of the options?
Yes, Father.
Which
B
one?
further.
B.
Yeah.
B1.
Let's mark it. We are not sure. We are not sure. We will mark it. Okay. The so-called hygiene hypothesis. This is a second hypothesis. Okay. Hygiene hypothesis is the second hypothesis. Hypothesis suggests too low an exposure to allergens is to blame. Too low. And here it is
High
to have
exposure.
high
High
exposure
exposure.
to an. Do they contradict?
Yeah.
Yes,
Yeah.
Father.
Yeah,
Yes,
they
Father.
contradict each other. One says
Mhm.
you should have high exposure to an allergic foodstuff. Here it says too low an
Too
exposure
low.
to allergens is to blame. Just contradicts.
Mm.
You understood this, right?
Yes, Father.
They both appear to be credible.
No.
Not
Now,
credible.
clearly, the field of immunology has only just scratched. They have not gone in deep. Okay, just scratched. Okay, means not at all credible. Now,
Okay.
for the nursing final year exam, you just looked at the book. Will your study is credible? No.
No.
Yeah, so that can be eliminated with a smile, right?
Yeah.
Yeah, elimination should be always with a smile. Okay, because you are reaching closer to the right answer. And C option, they fail to define their terms adequately. Nothing is mentioned about whether they adequately define. Did they mention anything?
No.
Not given. Not given. They should both be studied in more depth.
Not
No,
mentioned.
the scratch doesn't. They say it is only scratched. No proper study is done, but they are not saying you should study both the options hypothesis in more depth. It is not said at all.
Yeah.
The paragraph says you have only scratched, not studied well. That doesn't mean you have to study in more depth. They have not said it in the paragraph. It is not given. Clear?
Yes, Father.
So ultimately, B is the
This is the answer.
answer. 12. This is the same paragraph, so we need not go in detail. What is the type of question?
Lexical questions.
Lexical. What does the phrase this rule in the fifth
This
paragraph
rule.
paper 2?
Fifth paragraph.
This rule. The rule is that you have to go just before or
Just
soon after.
before the.
So where to go now? Just before. What is given just before is this. To be born of a parents and then to have a high prevalence exposure to allergic stuff. This is just before, right?
Yes, Father.
Mm.
And now you'll have to see. Sutta says the ideal recipe for a food allergy is to be born of allergic parents and then to have a high exposure to an allergic foodstuff. Now let's see option A. The likelihood of having an inherited allergy to certain foods. Inherited, only inherited.
Not
Plural
only.
and singular. Plural and singular. This is singular. Here you have two things. One is to be born of allergic
One of allergic
patients
parents.
means inherited. Right? Is
Inherited.
that clear?
Yes.
Yes, Father.
Inherited. I'll make this also same color. And now second option, which means this is singular, one factor. Whereas second factor, to have a high exposure to an allergic
Exposure to
stuff is
allergic
not
stuff.
mentioned. So you cannot say this is the rule. This is half of the rule. First option
Yeah.
is half of the
Half
rule.
of the.
Okay.
Okay.
If you are gifted a bracelet and somebody hands it over half of it, you will ask definitely where is the other half. You want the full bracelet, right? So
Yeah.
we don't want this half. How sweet is it if you think this way,
Mm.
right?
Yes.
Now, second one, the option B, the type of diet in which food allergies more commonly occur. Diet.
And
And then to have high
some-
exposure to an allergic foodstuff is diet, right?
this
Allergic
also half.
foodstuff is diet. This is again half.
Half.
Only one. Two things are there. So immediately, that's why it's singular and plural, I said, told you.
Yeah.
See, if you really respond and go on well with me, I can guide you easily to score even A grade, no issues.
Yeah.
These are all official materials, you see. Then third one,
With the degrees.
this is the degree of contact with allergens needed to trigger reaction. Degree of contact. Does it this rule speak of how much contact should be there with the allergens? You should eat the food 3 times a day, 2 times a day, 5 times a day, or continuously keep the food inside your stomach? Does it mention here in this particular
No.
highlighted sentence?
No.
Nothing else you need to think, okay. Lexical question, only this previous sentence or the next sentence. So it's very difficult to find out the correct answer, right? Where is the correct answer? Then you need not understand the fourth option. Already you have eliminated 3. They are the one. What is the order of events most commonly found prior to allergic attacks? Order of events is first event is your parent should be allergic to food. Yeah, they should be highly allergic to food stuffs.
And then
First, second, and then shows the order. Next,
yeah.
Secondly,
Order
and
of
then
event.
means, and then to have a high exposure to allergic foodstuffs. So the order of events most commonly found prior to allergic attacks.
Wonderful.
Cool. Do you need any more explanation about this?
No.
Yes.
Cool. Yes.
Yes,
What do you
Father.
say? Should I stop?
Yeah. No. Yes, Father, we have enough.
Father, continue.
Yeah. 13th one, another beautiful one. I simply love these questions. See, 13th one. What does the 6th paragraph suggest about the transference of allergies between mother and child? What is important?
Mother and child.
Transference between?
Mother and
Sixth. And option A, it is only possible with the particular individuals. Only
eliminate.
is absolute. So we will eliminate and see whether it is correct. Elimination is correct. Okay. We don't know.
Yes,
we don't
Father.
know. We haven't gone to the text. Okay.
Yes.
Second one, it can result in instances of malnourishment. Result. Third one, it may be avoidable if certain precautions are taken. May be avoidable. Third one, it is
For the baby.
most likely
Most
to
likely.
take place before the baby is born, before the birth. So we'll have to think whether after the baby born or before the baby born, transference of allergies between mother and child.
Before.
After.
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 Is it after?
Yes,
Father.
mother and child is after.
Both.
After
Yes.
means
Before.
transference of allergies between mother and child.
Before.
Is it likely before the baby is born or after the birth?
Before.
After the birth.
I mentioned after birth, Father. Can be
we'll see,
transferred through a mother.
Yeah, let's see. We'll go into text, please. Let's look into this one. Read and follow. Okay. Now, already someone suggested this D option. It's here. The text says there is evidence that allergens can be transferred to
Mother's breast
through
milk also
mother's
mentioned.
breast milk
And
or
possibly
through placenta.
before and after.
Evidence that allergens
Plus-
can be transferred through a mother's breast milk can be made model verb. Can be means you can definitely score 415 reading. Is a possibility.
Yeah.
Maybe then you will respond saying, Father, maybe a possibly, or I wish I could.
Okay.
Okay. My statement is factual, possibility. It is possible for you. But then other one is
Possibly.
possibly, also, maybe. So it is most likely to take place. Most likely. Other one is maybe.
Maybe.
This is most likely.
Most likely. Opposite.
So is it most likely after birth or before birth? Mother's breast milk.
After.
So before can be. That's what I said.
Eliminate.
The sequence, the tense or the sequence of the order can. Yeah. Now two are left.
Yes.
It can result in instances of malnourishment. Something is said about malnourishment somewhere. One US study found that parents sometimes avoided foods to which they erroneously believed children are allergic, occasionally leaving the children severely unfed means unfed means malnourished, right? It can result in instances of
Malnourishment.
See, question is what does the paragraph suggest about the transference of allergies between mother and child? It is not, they are not asking about malnourishment of the child. They are asking about the transference of allergies between mother and child.
Yeah.
Nothing about the child, health of the child, nourishment of the child, malnourishment of the child. Question is not asking it, though it is given in the. That's why I said you have to spend time on the question. Edging words, keywords. If you don't understand, okay, it is given here. It's clearly given here. Okay, so B can be eliminated, right?
Yes, Father.
Which is left then?
C.
C.
You need not understand what is C then if you are sure about the elimination, but still, let's see what it is.
It may be avoidable if certain precautions are taken.
It may be avoidable if certain precautions are taken. What do they say about precautions?
Would be advised to avoid certain foods.
Certain foods during pregnancy.
Would be advised to avoid certain foods during pregnancy and breastfeeding.
And
May be
breastfeeding.
avoidable if certain precautions are taken. Yeah. Okay. Women in allergic families could be advised to.
Yes, ma'am.
The last one.
Name Dr. Sutter. Suggest.
Yes, Dr. Sutter suggests that the rise in cases of one allergy may be partly due to. There is due to. Okay, Dr. Sutter suggests suggests that the rise in cases of one allergy may be partly due to. They are asking for a reason, right? Reason. Due to. Due to means due to this reason, due to that reason.
Okay.
First option, attempts to improve eating habits. Due to attempts to improve eating habits.
Manufacturing.
Why there is high allergy? Is it because of people want to improve eating habits? Second one, changes in food manufacturing methods. Manufacturing is the problem. First one is we want to eat food, different types, different varieties, improve eating habits, eat pizza, eat fast food, all these things. Second one is manufacturing methods. The factory people are manufacturing, not manufacturing properly. The third one is adoption of new agricultural practices. Okay. Farmers are to be blamed for all the allergies. Okay. Fourth one, increased levels of harmful substances in the atmosphere. Atmosphere has to be blamed. Okay. Food allergy, because there are harmful some substance in the atmosphere, you have food allergy. Is it okay? No food. There is no food, only air.
No chance.
Yes, Father.
Okay. Anyhow, let's see. Let's look into this one, read and follow. Okay. Any idea? Since I have taught this several times, so many of these types, I have highlighted without your permission. I have highlighted some red. The question is, Dr. Sorter suggests. The first part speaks about some doctors. Next part speaks about some experts. The
Experts.
following part speaks about Dr. Sorter.
Dr.
So where you
Soter.
have to immediately go?
Dr.
After the name
Soter.
of Dr. Soter.
After
Yeah.
Dr. Soter
Again, some plural, some experts plural, some doctors plural, but Dr.
Plural.
Sorter is singular. Now, any idea here? You can go once again read by yourself this portion after Sorter.
No.
Anything familiar?
Yes, Father.
Attempts to improve
Option
eating
A.
habits.
Huh?
Option A, Father.
Attempts to improve
Option A.
eating habits.
Attempts to improve eating
Yeah.
habits.
Yeah.
Increasingly turning to nuts
Eating
as
habits
a
because
source
they
of healthy
eat a lot
fats.
of nuts. Maybe many of you, as you are listening or attending this session, you are eating nuts because doctor said this is very nice. And then again, there you have seen some YouTube videos. Eat nuts and you will become nuts. Okay, cool. Just joking. Okay, cool. In lightweight. How nice it is. That's great. So sweet. 15th question. What information can be found in the first paragraph? Tell me the heading words, shout out and type in
Information. For
information and first paragraph. Okay, option A, reference to some recent findings relating to heart disease.
Findings.
What is the heading word?
Recent findings.
Okay, recent findings. Then by option B, indication of the greatest risk factor associated with heart disease.
Greater risk.
Risk factor.
Factor or greatest risk factor. Okay. Option C, mention of a misconception about the chief causes of heart disease.
Chief causes.
Yeah. Okay. Option D, figures showing the country with the highest mortality rate from heart disease.
Highest mortality rate.
Highest
Yes.
mortality rate.
Highest mortality rate is. Okay. So the concepts are these: findings, factors, causes, mortality rate, right?
Yes, Father.
Okay.
Yes, Father.
Yeah. Heart disease is the greatest killer in the developed world today, currently accounting for 30% of all deaths in Australia. A concept which is familiar to us all is that traditional risk factors such as smoking, obesity, and genetic makeup increase the risk of heart disease. However, it's now becoming apparent that another factor is at play, a developmental programming that is predetermined before birth, not only by our genes, but also by their interaction with the quality of our prenatal environment. Okay. Come on now. Do you find something to be highlighted immediately?
However, further contrast word.
Okay. If there is a contrast word, as you skim through, read fast, skim through, you have to highlight that contrast word. And the EduSkills strategy says, if there is a contrast word, you can just ignore what comes before it, and the answer will be definitely after the contrast word. Okay, from here, you have to find out if there is some connection with any of these answer options. Is it about are they speaking about recent findings, risk factors, chief causes, mortality rate? Now, after, however, is there some word reference to some recent findings relating to the heart disease, indications of the greatest risk factor? Do they speak about greatest risk factor?
No, Father.
No, they are speaking about heart disease is the greatest killer. Okay. They are not speaking about the greatest risk factor. A mention of the misconception about chief causes of heart disease. Do they speak anything about chief causes? No, they are just mentioning traditional causes and modern new causes, old causes and new causes that are found out. Figures showing the country with the highest mortality rate from the heart disease. It shows one country, but does it speak anything highest? Does it compare with anything? No, they don't compare at all. Only one country is mentioned, so you can't say highest. It's 30%. Okay. So ultimately, what is the answer?
Option.
Yeah. See, now is
Recent.
now synonym is
Recent.
recent. Yes. Yes. Any other synonyms or synonymous language? Becoming apparent. Findings.
Finding related.
Findings relating. Okay, findings. And that another factor. And again, I told you when there is a sequential expression, it's also an indication that will be the answer. Sequential expression, first one, second one, third one, first one, another factor, third factor. All these are sequential expressions. Then after hyphen, whatever comes is just explaining that particular thing, what is said now. See, another factor at play. What factor? That's being explained now. A developmental programming that is predetermined before birth, not only by our genes, but also by their interaction with the quality of a prenatal environment. Hope that is clear. So it looks like this. Beautiful. When the writer uses the word cost in the second paragraph, she is referring to. It's actually no need of hedging words here. The hedging word is highlighted. What type of question is this?
Lexical type question.
Lexical question.
Lexical type of questions. The
Lexical
principle, the clue or the strategy is that go to the highlighted word in the text. Okay, now write down. They come at a cost. Just write down on your notebook fast. They come at a cost. So here, what is they?
They subject further.
Yeah. Subject is they. And verb?
Come.
Come. Come is the verb. And at a cost is?
Adjectives.
Object. Okay, subject, verb, object. Cost is object. So as per our principle, where will be the answer?
Next to the highlighted word.
Yeah, next to. So let's just highlight the next half of the sentence, maybe immediately after this, and check whether that has got similarity with any of the options.
Growth.
Now, option A is overwhelming evidence. B, placental insufficiency. C, viable pregnancy. D, reduced growth.
D is answer.
See, biological trade-off is reduced growth. So easy. Biological trade-off means what you suffer or what is the cost. Okay. So you need not go anywhere else. Lexical questions from 2 texts, you have 4 questions which you can finish within a minute so that you save a lot of time for other questions. So cost is object. So the answer is after the highlighted word. Is that clear?
Yes, Father.
So 17th question. In the third paragraph, what does the author suggest about the work of the international research community on this subject? So what is the hedging word in the question stem?
Third paragraph, suggest.
Okay. Now author suggests. That's an opinion, okay?
International research community.
Yeah, this is very, very important. Research community. International research community on this subject, okay? On a particular subject, what they are mentioning here. First option, their focus has been too narrow.
Too narrow.
Too narrow. Second, studies flawed. Then there is nothing original about their nothing original. They were overly keen to seize on a particular idea. Particular idea. Okay. Now let's just go to it. Okay. Whatever it is, the idea that a fetus susceptible to disease in later life could be programmed by the conditions in the womb has been taken up vigorously by the international research community. International research community. This is a subject taken by them for study, with considerable efforts concentrating on nutrient supply across the placenta as a risk factor. But that is just part of the story. How much oxygen is available to the fetus is also a determinant of growth and of the risk of adult disease. Dr. Dino Ghesani's research group of, do we need Dr. Dino Ghesani and other Cambridge University?
No, Father. No.
We are not bothered about them. We are bothered about
International
research community. Do you find anything that need to be highlighted?
Father. Contrast word.
Yeah, there is a contrast word. If there is a contrast word, he is our friend. He is the greatest person who will help us. and tell us. Answer is here. Answer is here. So many questions, you see, with this strategy. But that is just, let's see whether it is right. That is just part of the story. Do you have any similarity? That is just part of the story. If you have heard that story, what is the answer?
Option
A.
Further. Too narrow. The
Option
focus
A,
has
father.
been too narrow.
Yeah, focus has been too narrow. That is a clear paraphrasing of that is just part of the story. And some of their studies may be flawed. They don't say whether the study is flawed, right or wrong. They have not mentioned, right?
Yes.
They have not mentioned, evaluated the study at all. There is no evaluation of the study here. But after the contrast word, immediately they say that is just part of the story. Means the focus has been too narrow. One part of the body, one part of the story. The name, then the contrast word, the clues here. Going to question number 18. What was the aim of the study described in the fourth paragraph? Aim of the study, right? Fourth paragraph, definitely it is there. So option A, to compare neonatal records between the UK and Bolivia. Option B, to assess the relative significance of two risk factors for newborns.
Risk factors.
Risk factors. To find a link between birth weight and predisposition to heart disease. Link between birth weight and heart disease. So when you read, you have to see whether they are speaking about a link, or are they comparing between UK and Bolivia, or are they speaking about two factors, risk factors. D, option D, to determine the likelihood of high altitude babies being carried to full term. Yes?
High altitude babies.
High altitude babies. So we are experts in finding the keywords now. Let's look into this one, read and follow, okay? So, any idea?
It is only two Bolivian cities. They are not comparing UK and Bolivia, so we can eliminate.
Yeah, it's two Bolivian cities. So nothing about UK is mentioned here. Maybe OET aspirants are interested about UK. That's why they wanted to confuse you. Okay? Okay, cool. So this is eliminated. C, to find a link between birth weight and predisposition to heart disease. Do they mention anything about heart disease?
No,
Nothing is mentioned about
disease.
heart disease. Then option D, to determine the
Also,
likelihood of high altitude babies being carried to full term.
that is also not mentioned. They have mentioned underweight babies, not about full term pregnancies.
Yeah, underweight babies. Yeah, the study is about underweight babies, and they are not speaking about full term. But this a result of reduced oxygen
Poor
in the
nutrition.
womb, or poor nutritional status? What are they?
Two risk
Two
factors.
risk factors.
Two risk factors,
Yeah,
father.
two risk
Reduce.
factors. As medical professionals, you know, these are the two risk factors where you will have undergrowth babies, right? So these are the two factors. Is that clear? To assess the relative significance of two factors for newborns. So B is the answer. Okay, 19. What assumption was proved wrong by the results of this study? What is a hedging word?
Assumption.
Assumption. Some assumption was proved by the study. Option A, lower income mothers generally give birth to lower weight babies. Lower income?
Lower income mothers, lower weight babies.
So just to remember, you can lower income, lower weight. Okay. Option B, a baby born at high altitude will typically weigh less than one born at sea level. High
Less than
altitude, less weight. And option C, levels of oxygen have a greater impact on birth weight than nutritional status. Oxygen is more important than nutritional status. Option D, there is a correlation between prenatal oxygen levels and predisposition to heart disease. Correlation between prenatal oxygen levels Okay. Now, any word that need to be highlighted?
Contrast word, Father.
Which one?
But the fifth
Where is?
sentence, there is fifth sentence, Father. But the effect of undernutrition.
1, 2, 3, 4, 5. But.
Yes.
Okay. But.
There is also
Father,
although also.
remarkably
Okay.
also.
Remarkably also is there. Remarkably means
Although.
when your teacher teaches, this is very, very important. Mark it. Remarkably. They are highlighting and saying remarkably. And again, there is one more contrast word. I said when there are two contrast words, normally answer will be the after the second contrast word. Hope you remember. There were questions when there were questions saying that there are two contrast words. What should we do? So normally, if there are two contrast words, generally after definitely it is not before the first contrast word. Okay. And normally it is after the second contrast word. Now assume, one might assume. Assume, is there something in the question stem?
Assumption.
Yeah. Although one might assume, and if a sentence begins with although, if there is a complex sentence, the answer will be in the independent clause. Answer will be in the
Independent
clause. Although one might assume that babies born to mothers of low socioeconomic status at high altitude would show the greatest reduction in the birth weight, that is the first part is the dependent clause.
Dependent clause.
Okay. Then there will not be answer in the dependent clause. So you can just ignore and go to the independent clause. These babies were actually heavier than babies born to high-income mothers. Rich mothers. These babies were, although one might assume that babies born to mothers of low socioeconomic status means mothers who have less money, the kids of the poor people will have less weight. That is the assumption. Assumption means presumption, not fact. These babies were actually heavier than the babies born to high-income mothers, those who had enough money. These weighed more than babies born to rich mothers. So poor mothers' babies or rich mothers' baby, which was heavier?
Poor mothers' babies are heavier.
Yeah, poor mothers. So do you have any option? A baby born at high altitude will typically weigh less than one born at
A, Father. A.
Lower income mothers generally give birth to lower weight babies. But here they are saying what? One might assume, you may think, I will read it this way. Shanmuga may think that babies born to mothers of low socioeconomic status at high altitude would show the greatest reduction in birth weight. They will have lower weight. You may assume. I striked it out. That is in the dependent clause. Answer will never be in the dependent clause. What you are saying now is given in the dependent clause. That is also assumption. Here they are saying assumption proved wrong.
Opposite.
Did you get me?
Father.
Here they are asking what assumption was proved wrong. Assumption. What was the assumption? Poor mothers will have less weight babies, lower weight babies. But this study showed poor mothers have higher weight babies. These babies were actually heavier than babies born to high-income mothers at a high altitude. The fact found out in this study is that lower income mothers have higher weight babies. So which assumption, presumption, speculation was proved wrong?
Lower income mothers
Low
must be
income
below overweight
babies.
babies.
This fact is not right. This is the assumption which is proved wrong.
Wrong.
That is the
A is
answer.
Yes, Father.
You have to be very cautious about such negative questions. Which assumption was proved wrong? But the assumption was, people thought, the presumption, speculation was that lower income mothers will have low weight babies. But that was disproved by this particular study. Is that cool?
Yes, Father.
Yes, Father.
Yeah. Option B, a baby born at high altitude will typically weigh less than one born at sea level. Now you see, what Gusani found was that the high altitude babies showed a pronounced reduction in birth weight compared with low altitude babies, even in cases of high maternal nutritional status. So here they are saying a baby born at high altitude will typically weigh less than one born at sea level. Means those who born at high altitude will weigh less. Correct, no? High altitude will have pronounced reduction in weight.
Yes, Father.
Yes, Father, that's correct.
But that was not an assumption. I am trying to make you understand the difference. That was not, the paragraph is not saying that was an assumption. That was found. Means established fact. That was
Fact.
established fact. But the question is not asking about established fact. They are asking what assumption was proved wrong. So you should be very careful when there is a negative question. Okay. And see, levels of oxygen have a greater impact on birth weight than nutritional status does. They are not speaking, comparing levels of oxygen and nutrition. There is a correlation between prenatal oxygen levels and predisposition to heart disease. Do they speak anything about heart disease here?
No, Father.
Anywhere heart disease is mentioned?
No.
No. So maybe right as per the medical knowledge, but they are asking what is given in this particular paragraph. Okay, that is cool. Type cool if you are okay. Question number 20. Have a glance, read yourself. Okay. Okay, time up. Somebody.
Please answer.
Why?
A option has got absolute all, so I eliminated. And B
Okay.
also has got absolute all, eliminated. And C is not meant.
Not meant. Now,
Yes.
if there are beginners, all and only, no one, everyone, those are the absolutes. Absolutes, if they happen, normally that can be immediately eliminated if there is absolute expression. But if the statement says not all socioeconomic groups, that is not all. Not all. Means some. So beware of that. Here also you have at all levels. If there is an absolute, immediately you can eliminate. So you are left with only two options. So you have to read and understand. The lower social economic groups of lepers are almost entirely made up of Amerindians, an ancient ethnic group with a history in the Bolivian highlands spanning a couple of millennia. And in the C option, what is that?
2000 years.
2000
Time
years.
expression.
Are they same?
No, Father.
No, Father.
So there itself, from the very first sentence, you can eliminate third option. Okay. Most residents have a shared. On the other hand, what is that?
Sequential expression, Father.
Sequential expression, next idea, which means whenever there is another thing, another idea, sequential expression, answer will definitely happen after the sequential expression, not before that. Okay, that's the principle. Keep writing down these principles. Remember as you scan through and get these ideas. On the other hand, individuals of higher socioeconomic status represent a largely European and North American admixture, relative newcomers to high altitude. And the newcomers, there is a scale, new. Newcomers to high altitude. Okay, higher socio-economic status means rich people are the newcomers. They have no ancestry. They are not there from millennia. They are the rich people are the newcomers. They have no ancestry over there. It seems therefore that ancestry linked to prolonged high altitude residence confers protection against reduced atmospheric oxygen. Poorer residents have a genetic advantage over those with higher incomes. See, here prolonged high altitude residence means living long time at high altitude. Who lived long time? Rich or the poor?
Poor.
See, the lower socio-economic groups were there from a couple of millennia. They were living there. Whereas individuals of higher socio-economic status are relatively newcomers to high altitude. Tell me whether poor people have a longer ancestry or higher rich people. Who stayed longer in high altitude? Poorer people or rich people?
Poorer people.
Yeah. So that is what D says, no? Poor residents have a genetic advantage over those with higher incomes. That's what last sentence says. Those with long ancestry, prolonged stay in high altitude has a protection against reduced oxygen.
Reduced atmospheric oxygen.
Means so D is the answer. See, this is how. Text 7, question 21. The purpose of the information in the 6th paragraph is to provide the purpose. What is the purpose? Option A, an alternative approach to a puzzle. Puzzle is solved. A confirmation of a hypothesis. Hypothesis is confirmed. Then an explanation for a finding.
Finding.
Okay, finding. And a solution to a problem. These are the concept-based edging words, but differentiating edging words are solution, explanation,
confirmation, alternative approach.
Now let's read. Do they present any problem here? If the problem is given, it will be in the beginning, as I told you, in the first sentence. Is there a problem given in the first sentence?
No, Father.
No, they are just making a statement. So no problem given. So solution problem is not possible. And alternative approach to a puzzle, are there two approaches given or any puzzle mentioned? No. Same paragraph, two questions, one paragraph. It becomes very easier for you. A confirmation of a hypothesis, like assumption, you remember previous question, assumption. Is there a confirmation about a hypothesis? Other one was disproving the hypothesis. Here they are saying, is it a confirmation of a hypothesis, confirmation of a assumption? Do they mention any assumptions here? Hypothesis?
No.
Hypothesis means assumption.
No.
So it is an explanation for a finding. See, they are explaining why the poorer people or the people having a prolonged stay in high altitude, they will be more healthy because they have affluent of oxygen, enough oxygen. It seems, therefore, that an ancestry linked to prolonged high altitude residence confers protection against reduced atmospheric oxygen. Means they have no reduced oxygen, they have high level of oxygen. So it's an explanation of the finding. The whole paragraph is an explanation. At the end, they are concluding saying, okay, therefore, you explain something and then you conclude, right? Saying, therefore, we say OET aspirants are smart students. Before that, you have to explain why, right?
Yes, Father.
Yes, Father.
Thank you. Okay, so this is clear, right? Answer is?
Yes, Father, clear.
C.
Yes, Father.
Answer is C, an explanation for your finding. The last one, you have stamina?
Yes, Father.
Yes. Now, 22nd. What advantage of the research involving hen eggs is mentioned in the final paragraph? Advantage.
Final paragraph.
Then involving NHEX also is important, maybe, because you should know the subject, right? Option A, the availability of supplies. Supplies. Then simplicity of procedure.
Procedure.
Advantage is the simplicity of procedure, reliability of the data obtained or data is the concept. The speed with which results are seen. Results. And differentiating edging words are availability. Other one is simplicity. Then reliability. These are the differentiating edging words or keywords. First part we marked is concept based. Speed. So, any idea? Is there a contrast word?
But.
So answer must be after the contrast word. But the embryos were actually larger than sea level embryos incubated at sea level. The researchers could thereby demonstrate something that only generations of migration in human populations would reveal. What is the meaning of this? Things in hen eggs they could do within no time. But in humans, if this has to be treated, it will take generations. Does it show anything? Tell you anything?
The speed.
The speed. The speed, exactly. Means they are saying in NHEX, they could find the result within no time. Whereas if it is done with this research is done with human beings, generations, it will take generations. Is that clear? And they don't speak anything about supplies, right? And simplicity of the procedure. They did not speak anything about the procedure. What was the procedure? How was it done? Reliability of the data obtained. They are not saying whether data obtained is okay or not okay. They are saying this is faster. They got it very fast. That sentence clearly tells you the researchers could thereby demonstrate something that only generations of migration in human populations would reveal.
Yes, Father.
The speed with which results are seen. Beautiful. Okay, that is cool. See now, contrast words. Some are asking what are the contrast words. So these are the contrast words. Although, but, however, in spite of, despite, though, yet, nevertheless, whereas. So that's the end of it. I hope this is cool.